Upon arriving to labor and delivery, you, as the patient, will sign a form with pertinent and personal information and reason for visit at the nurse's station. A nurse will then walk you to a triage room where you will be instructed to change into a hospital gown and possibly provide a urine sample. The nurse will apply fetal monitors that record your baby's heartbeat and contractions or listen to your baby's heartbeat with the fetal Doppler. Your vital signs will also be recorded. You will be asked to sign consents for treatment and insurance billing. Your nurse will ask you a series of questions pertaining to your medical, pregnancy, surgical, and social history. Your information will be relayed to your doctor, who will be in to see you as soon as possible, usually within 30 minutes to an hour. Usual procedures that are performed when the doctor arrives are vaginal exams and speculum exams. You may be administered IV fluids, blood samples may be drawn, and you may receive medications. Welcome to your second trimester. Even though you don't notice it, your body is adapting to meet the needs of your growing baby. There are many changes occurring within your body. Your uterus is expanding, so as the weeks go by, you may notice that you are feeling more pressure on your bladder, stomach, and other organs. You may notice some skin color changes on your forehead, nose, and cheeks. Freckles may darken and moles may grow. You may notice a dark line on your belly between your belly button and pubic bone. This is called linea nigra. By the end of your second trimester, your baby will weigh anywhere from 1 to 2 pounds and is about 12 inches long and has fingerprints, hair, and nails. You may also be feeling movement. If you are still experiencing nausea, try getting up slowly and eat a few crackers before getting out of bed. Eat small, light protein meals at frequent intervals. Try drinking water with lemon slices. If you are still experiencing fatigue, try taking regular naps, exercising, and accepting help from others. Headaches are another common pregnancy symptom. The best way to limit them is trying to get fresh air and exercise, taking time to relax and rest, eating a healthy diet, and avoid skipping meals. Ankle swelling is another common pregnancy complaint. To reduce this, try sitting with your feet raised periodically throughout the day and wear support hose if you plan to be on your feet for a long time. Many women experience pain in their lower abdomen and groin area. This is called round ligament pain and is associated with the stretching of ligaments and muscles as your uterus grows to accommodate your baby. Avoid sudden twisting movements and take Tylenol as directed if necessary. Leg cramps can be relieved by flexing your foot, wearing comfortable shoes with flexible soles, and leg massages. It is important to establish healthy eating habits during pregnancy for the health of you and your baby. Aim for a healthy weight. A slow and steady weight gain is best. This is not the time to diet, but eating healthy foods is essential for getting the nutrients that you and your baby need. Avoid alcohol, unpasteurized meats and cheeses, deli meats, and hot dogs unless heated, and certain fish that is high in mercury. Limit caffeine and artificial sweeteners. Drink plenty of fluids to decrease constipation, flush out toxins, limit swelling, and reduce bladder infections. 8 to 10 cups of water a day is recommended. Welcome to your third trimester. Your body is preparing for the birth of your baby. Your body is changing rapidly. You will gain more weight from fluids, extra blood, and fat deposits. Your breast will grow as your body prepares to feed your baby. They may be more tender, and you may notice a slight yellow or clear discharge from your nipples. This is called colostrum and is the first milk your baby will drink. You may notice an increase in vaginal discharge. As long as the discharge is not foul-smelling or an odd color, then this is totally normal. Your body is building up fat, their brain is growing, and lungs are maturing. This continues well up until the birth of your baby. By the end of your third trimester, your baby will be somewhere from 18 to 20 inches long and weigh in between 6 and 9 pounds. One common pregnancy complaint during this trimester is constipation and hemorrhoids. Eat foods that are high in fiber, exercise, and drink enough fluids. Sleep and nap on your side to reduce the pressure on the veins of your rectum. Try not to sit or stand for long periods of time. Back pain is another common pregnancy symptom. Physical changes in your body can strain your back and supporting muscles. Also, hormones increase during pregnancy that can affect how your muscles and joints work together. This pain can occur in the upper or lower back as well as the pelvis. Some women have sciatica, which is pain caused by pressure on the sciatic nerve running down the back of the leg. Stretching exercises can help. To limit heartburn, avoid spicy or acidic foods. Eat slowly and smaller amounts more often. Wait 2 hours before lying down after eating and sleep with your body raised at least 6 inches. One way to know that your baby is doing well in the third trimester is to record your baby's movements once a day, called kick counts. Choose a time when your baby is active, such as after a meal. Lay on your side with a pen and a paper. The first time the baby moves, write it down. Count each movement until the baby has moved 10 times. This can take from 20 minutes to 2 hours. If the baby has not moved at least 4 times in 1 hour, pat your stomach to wake the baby up. Eat, drink something, and lay on your side. If the baby still doesn't move, call your provider. Try to do this at the same time each day. Call your healthcare provider if the baby does not move at least 10 times in 2 hours. If you have not felt your baby move all day, or if the baby is much less active today than any other days in the past. The beginning of labor is the beginning of birth. You will start to feel strong contractions. This is when the muscles of your uterus start to tighten to help push the baby out during birth. Many women feel contractions in their lower abdomen and back, but it is not uncommon to also feel them in your hips, legs, and vagina. True labor contractions may start out mild, but soon become more regular and stronger. False labor contractions may be frequent and painful, but lack a regular pattern. False labor contractions may stop on their own or at the beginning or end of an activity, whereas true labor contractions do not stop no matter what you are doing. True labor has probably started if your contractions are getting stronger and stronger instead of weaker. Your contractions are regular, usually every 5 minutes or less, and getting closer together. You may have pink-colored or blood-streaked mucus from your vagina. If your water breaks, it may be a gush or slow trickle of clear fluid. It is probably not true labor if your contractions go away when you walk or change positions and after drinking water. Call your doctor right away if you notice any fluid leaking from your vagina, bleeding, heavy enough to soak a sanitary pad, or you don't feel your baby moving as much as before. Home care for false labor starts with keeping a record of your contractions. Write down when each one starts and how long it lasts. Look for a pattern of regularly spaced out contractions with a gradual increase in the frequency and duration. Drink plenty of water, take Tylenol as directed, go for a walk, take a warm bath, and finally, try to nap.